vaccine sends a very important message to your own immune system to create antibodies to fight the coronavirus, so that if you are exposed to the virus, you are already protected. You have antibodies ready to fight the virus. The vaccine has been given to millions of people worldwide with very rare serious side effects. The very rare side effects are investigated very carefully, and if any action needs to be taken, it will be.
I decided to take the vaccine because it's the best way to put an end to the pandemic. The COVID-19 virus is very serious, and some survivors have severe and potentially long-lasting medical complications. Getting the vaccine also protects others. It's not just about us. When enough of us get vaccinated, COVID-19 will not be able to spread or mutate as quickly, and the pandemic will end.
Some people get no side effects at all, although most people feel something. A lot of people will have soreness in their arm at the site of the injection. Many people, beginning 6 to 12 hours after the vaccine, will feel tired or maybe get mild headaches. Some will notice fevers and chills. These are not signs that you have the COVID-19 virus. There is no virus in the vaccine. These are normal signs of your immune system turning on to develop the immune reaction that we're looking for. So no need to worry. You might not schedule much the day or two after the vaccine, given that you might feel down for a little bit, but that's time limited. It should be no more than a day or two.
The great news is that all of the approved vaccines are highly effective in preventing serious illness, hospitalization, and death. Even if you're one of the very, very rare individuals who contracts the virus after getting vaccinated, your chance of serious illness or death is virtually zero. All of the vaccines are amazingly effective. Get whatever vaccine is available.
Yes, the vaccine does not interact directly with any psychiatric medications that we know of. The medications will not affect how the vaccine works, and the vaccine will not change the effectiveness of your medications. It's entirely safe to take the vaccine if you're taking medications for a psychiatric condition. Yes, and this is important. Many people with autoimmune conditions have compromised immune systems and are more susceptible or vulnerable to side effects from the COVID-19 illness. So it's important to consider getting a vaccine, even if you have an autoimmune illness. You should talk to your doctor who treats you for the autoimmune illness, who may want to adjust some of the medications you take for that illness around the time you get the vaccine. If you have common allergies, you can still be vaccinated. There's no concern if you have hay fever or common allergies to mold, what have you, pets, animals, that's fine. There should be no real concern about taking the vaccine. If you've had a prior allergic reaction to a vaccine, you should talk to your doctor first. It doesn't mean you cannot take the COVID vaccine, but you should discuss it with your doctor and consider any precautions. For example, maybe you take the COVID vaccine and you might be monitored for a longer period of time, maybe 30 minutes instead of 15 minutes after taking the vaccine. But discuss that with your doctor.
Yes, you can, and yes, you must. The scientific data shows us the effective COVID-19 vaccines will allow your body to develop a very strong and robust immune response, such that you have a large army of antibodies to fight a COVID-19 infection. It will also help you to fight any of the variants of COVID-19 that may come about. So if you've had a COVID-19 infection, you've had antibodies to COVID-19, you can still get the COVID-19 vaccine as long as it's after your isolation period, which is usually 10 days, and as long as you don't have a fever of 100 degrees or greater 24 hours prior to getting the vaccine. If you happen to develop a COVID-19 infection between the first and second dose of your COVID vaccine, you can still get the second dose of your vaccine as long as it is after your isolation period, which is 10 days, and as long as you don't have a fever of 100 degrees or greater 24 hours prior to getting the second dose of the vaccine. You can still get that second dose even if it's later than the original scheduled time. Please get your vaccine. It's safe and effective.
Yes, the great news is that the way the vaccines work have no impact on fertility. So you can be assured that you can get vaccinated even if you're trying to get pregnant. The initial trials did not specifically include people from these groups. However, the American College of Obstetrics and Gynecology says that the vaccine should not be withheld from people who are currently pregnant or lactating. Remember, if you contract COVID-19 while you are pregnant, there is a higher risk of complications and death. Emerging research shows that the vaccines are safe and effective for pregnant people and may even provide your newborn with antibodies. If you're pregnant, talk to your doctor before getting the vaccination.